similar to disparity as far as our health and finances, we also have disparities as far as our ability to grieve and the losses that we experience. And so the racial grief gap, essentially, not only for Black folks, but also for Indigenous folks and for other people of
Mm-hmm.
color, just shows that we experience death prematurely, so at an early age, exponentially more frequently, but also it has an impact on our health long term. And so there's a researcher that I really love her work. It's Deborah Umberson, and
Yeah.
she's at the University of Texas at Austin, and I've loved her work because she talks just about over our lifespan, specifically Black Americans, we experience so much loss related to the folks that we care about, so significant people in our lives, that it really has an impact on our health long term. Because what we know is that a lot of our relationships are a buffer to stress and a lot of adversity that we experience. But when you think about losing the people that are really helpful and paramount into countering that stress, really your
Mm-hmm.
ability to navigate life becomes more difficult and challenging. And so the racial grief gap really talks about how Black kids are more likely to, or three times more likely to lose their mother, two times more likely to lose their father. They're more likely to experience more than four deaths by the age of 60 of people who are really important to their development and their well-being, and to really kind of guiding them through life. And so one of our goals as far as kind of closing that racial grief gap is really to hone in on these important relationships, but also taking care of our mental health, taking care of our physical
Yeah.
health, taking care of our financial health, our spiritual health, so that we can continue to live longer, for our young adults and for our children and adolescents, so that there isn't a missing generation. And one way that I think that we can do that is really, like I said, prioritizing our health. Some of these deaths are beyond our control, of course, and some of them happen to be, very sudden and unexpected, and unfortunately just harmful, right? Like thinking about
Mm-hmm.
violence in the community, thinking about death by suicide and things like that. Some of the deaths are not preventable. So we like to say in the Bureau of Prisons that we are not guarantors of life. I don't want anyone to have that pressure.
Right.
But I will say that we can really help to lessen this gap by really focusing on our health, physical health, as far as chronic diseases, making sure we're eating right, making sure we're getting sleep, making sure we're having appropriate coping strategies for stress, because stress long term also has shown to, lessen our life expectancy. Taking care of our financial health. So that looks like getting wills and trust and life insurance, right? So that if we were to pass, our children have, some type of financial support so that they're not starting from scratch, basically. But also our
Yeah.
mental health, really focusing on our spirituality, focusing on our coping skills, making sure that we have a supportive network that is healthy and promotive rather than, strained and conflictual all the time. We really want to focus in on our health as far as reducing this gap while we're here on earth. That way that when we transition and we pass on, we're leaving a legacy of taking care of ourselves instead of leaving a legacy where we're, really struggling and trying to catch up the whole time.